Hi everyone, today my topic of discussion is duodenum, pancreas and spleen specimen. Now it has got the duodenum, you see it has got a C-shaped curve, and the duodenum is divided into different parts. The first part, that is the 2 inch in length, the second part that is 3 inch in length, and third part which is cut here, that is 4 inch in length, and ultimately the duodenum, the fourth part of the duodenum, that is 1 inch in length. Now this duodenum, you will see it has got a gland which is known as the Brunner's gland, which neutralizes the acid secreted within the stomach. Now in the interior of the duodenum, you will see what are the things you will notice here. There are transverse fold, and this transverse fold is the fold of the mucous membrane, which absorbs more of the substances which is secreted here. Now within the second part of the duodenum, you will get two papillae. One is the major duodenal papilla, another is the minor duodenal papilla. Over the major duodenal papilla, our bile duct and the pancreatic duct open, and the minor duodenal papilla, there is the accessory pancreatic duct open. You will see this major duodenal papilla, the bile comes out like a soap bubble in appearance. So you will see that is in the childhood, the soap bubbles you used to play, and that type of bile comes out within the interior, which one can see by passing an endoscope through it. And this is why the stomach releases the food amount through pylorus in a small amount, so that whole of the food will be mixed up with the bile. Now you will see the pancreas has got flattened head that lies within the concavity of the duodenum. Next is has got constricted neck, small one, and behind this neck you will see this is the superior mesenteric artery, which is thicker. You will see, if you feel, you can feel the texture of the artery, and this is the superior mesenteric vein. This superior mesenteric vein unite with the splenic vein and form the portal vein, which goes behind the neck of the pancreas. Next, this prismatic part is the body of the pancreas. This body has got 3 borders and 3 surfaces. One is the anterior border, you will see here the transverse mesocolon is attached. There is the superior border, and in this superior border the splenic artery goes through, and another is the posterior border which lies behind. And the surfaces are anterior surface, the posterior surface, and the inferior surface. So this is the pancreas, and you see this is the tail of the pancreas, and this tail of the pancreas lies within a ligament, and that is attached to the hilum of the spleen. This is the hilum, and this ligament is known as linorenal ligament. That means from the line, that means the spleen, it goes up to the kidney. So this is the linorenal ligament. So this is the pancreas. Now the spleen is the very friable organ, you know, and as it is friable during the football playing or during some blow in the abdomen, this spleen actually rupture, giving rise to severe hemorrhage. It is so the hemorrhage is there that the patient should immediately transfer to the hospital, and then spleen is removed to control the hemorrhage, and that procedure is known as the splenectomy. So this is known as the spleen. So you see the spleen has got the 2 surfaces. It follows the rule of the 2. It has got 2 surfaces, which is known as the visceral surface. Another is the diaphragmatic surface, which is more smooth. It has got 2 borders. One is the superior border. How will you identify the superior border? In the superior border, you will see there is the notch, and this notch indicates the spleen is the lobulated origin. The spleen follows the rule of the two. It has got two surfaces. One is the visceral surface, another is the smooth diaphragmatic surface. It has got two ends. The medial end, which is narrow and directed medially and upwards. The lateral end is broad. It is directed downwards and laterally. And you will see in the superior border there are the actually there is the notch, and this notch will be identified in a patient when the spleen is enlarged. Actually the spleen is not palpable in the normal patient, but when the patient suffering from chronic allergy or chronic malaria or some congenital spherocytosis, blood leukemia, then the spleen is enlarged. When the spleen is enlarged, that is about actually 3 times more than its normal size, then you can palpate the spleen. Otherwise, spleen is not palpable. Next, you will see this border is the hilum. And in the hilum, you will see the tail of the pancreas and the branches of the blood vessels, that is the splenic artery, as well as you will see the splenic vein comes out through it. And you will see the lymphatic. So I will actually trace the splenic artery, and these are the splenic vein. And these you will see more prominent in the fresh specimens, when a freshly dyed body. So how will you hold the specimen in anatomical position? First, you hold the duodenum on the right hand because it is situated on the right side. The pancreas in the middle and the spleen is on the left hand. So this is the anatomical position of the specimen, duodenum, pancreas, spleen. Now there are clinical anatomy, you know, the major papilla, duodenal papilla, which I will show you in the interior of the duodenum. There may be carcinoma, so there is blockage of the bile, and you will see there also that there may be the portal hypertension if there is the bile duct is obscure. And spleen, you will say, I will tell you more about the spleen. And this is all about the duodenum, pancreas, spleen.